Introduction. Macrolides is a broad-spectrum antibiotics that stop bacterial growth by inhibiting protein synthesis, commonly treating respiratory, skin, ear infection, and alternative for penicillin allergic patients. We have two types of drugs, which is azithromycin and erythromycin. First, we go to azithromycin. Azithromycin have brand names include Azithromax, Z-Pack, and Z-Max. Azithromycin is widely used prescription macrolide antibiotics. It is known for its long half-life, which allows for shorter treatment courses. Next, we have erythromycin. Erythromycin have many brand names, including Emycin, Eryt, and Erypac. It is available in several forms, including oral tablets, capsule, suspension, topical gels or solutions, and injections. Next, we have pharmacokinetics. Azithromycin absorption, oral bioavailability is low, approximately 38%. Distribution, excellent tissue penetration and strong intracellular penetration. Protein distributed widely, for example, like skin and lungs. And then highly concentrated in phagocyte, helping it reach inflamed areas. Then we have metabolism, mainly by liver, excretion through bile excretion, and half-life has really long half-life, approximately 68 hours, because it stays in tissue and cells. Next, we have erythromycin. Pharmacokinetics for erythromycin is absorption, rapid gastrointestinal absorption, distribution, wide distribution into tissue, but poor in CSF. And then metabolism, extensively metabolized in liver, mainly by CYP3A4 enzyme. Excretion, mostly excretion through bile and feces. Half-life, short half-life, like 1.5 to 2 hours. Move on to the next one is pharmacodynamics. Mechanism of action, azithromycin. First main action is azithromycin bind to the 23S rRNA of the 50S ribosomal subunit in bacteria. This blocks protein synthesis by preventing the growing peptide chain from moving through the ribosome. Effect on bacteria, mostly bacteriostatic, which is stop bacteria from growing. At higher doses, it can become bactericidal against some bacteria, for example, streptococci and influenza. And then gram-negative advantage, stay attached to gram-negative ribosome longer than erythromycin, which is better activity against gram-negative organism. And then intracellular action, enter tissue and cell easily and effective, which is effective against intracellular bacteria. And then we have action on certain parasite, which is in parasite like Plasmodium, Babesia, Toxoplasma. It inhibits the 50S ribosome in the upper corpus and organelle with bacteria like Macrolides. And then we have a mechanism of action, erythromycin. The main action is erythromycin bind to the 23S rRNA of the 50S ribosomal subunit. This blocks protein synthesis by stopping the transpeptidation and translocation step. It also prevents proper formation of 50S ribosomal subunit. Effect on bacteria, resulting in bacteriostatic effect, which is control bacterial growth and treat infection. Its strong binding to ribosome explain its broad spectrum activity.
Drug class. Antibiotic class is macrolides. Mechanism: inhibit bacterial protein synthesis by binding to 50S ribosomal subunit. For dosage, azithromycin. A respiratory or skin infection need 500 mg for day 1, and then 250 mg once daily for day 2 till day 5. For chlamydia, 1 gram single dose. For erythromycin, adults need 250 to 500 mg every 6 hours, and for children, 30 to 50 mg per kg per day in divided dose. For therapeutic effects and uses, azithromycin, respiratory tract infection, pharyngitis, bronchitis, pneumonia, and then skin and soft tissue infection. Next, chlamydia and other STI-related infection. Next is non-gonococcal urethritis, and lastly is prophylaxis for Mycobacterium avium complex. And next for erythromycin is respiratory tract infection such as tonsillitis, bronchitis, and pneumonia. And next is skin infection. Then pertussis, which is whooping cough, and next diphtheria and Campylobacter gastroenteritis, and lastly is alternative for patients allergic to penicillin.
Now, side effect for azithromycin, more common is nausea, vomiting, diarrhea, abdominal pain. For mild, dark, hairy stool, upset stomach, fatigue, headache, yeast infection, and dizziness. For erythromycin, the side effect is nausea, vomiting, diarrhea, loss of appetite, bloating, indigestion, and mild skin or itching. Now, side effect for azithromycin, more common is nausea, vomiting, diarrhea, abdominal pain. For mild, dark, hairy stool, upset stomach, fatigue, headache, yeast infection, and dizziness. For erythromycin, the side effect is nausea, vomiting, diarrhea, loss of appetite, bloating, indigestion. Next is adverse effect for azithromycin, which is serious allergic reaction like swelling of the face, lips, tongue, or throat. Examples: Steven-Johnson syndrome, toxic epidemic necrolysis, and Grass syndrome. Heart rhythm problems, liver injury, severe diarrhea like clostridial deficit associated diarrhea (CDAD), hearing impairment, and worsening of myasthenia gravis. Adverse effect for erythromycin like sign of liver problems, which is dark urine, pale, stools, severe pain in the upper right abdomen, or unusual tiredness. Next is heart rhythm changes, severe skin reaction like red, blistering, peeling, or loosening of the skin, severe watery or bloody diarrhea, and last convulsion or severe. Now, contraindication for azithromycin. It is not suitable for some people that ever had an allergic reaction to azithromycin or any other medicine, liver or kidney problems, heart problems including irregular heartbeats like arrhythmia, ever had diarrhea when you have taken antibiotics, myasthenia gravis, which is azithromycin can make the symptom of this muscle weakening condition worse, and last, diabetes, which is azithromycin liquid contains sugar. Next is contraindication for erythromycin. Erythromycin also not suitable for everyone that ever had an allergic reaction to erythromycin or other antibiotics, and a rare inherited blood disorder called porphyria, fast pounding or irregular heartbeats, sexually transmitted infection (STI) called syphilis, and you are pregnant. Erythromycin can make your symptom worse. Next is low potassium or magnesium levels, or have been diagnosed with this in the past and been trying to get pregnant, or you are pregnant or you are breastfeeding.
First, I will talk about azithromycin. When giving azithromycin, we need to take into account the formulation. For capsule, it should be taken on an empty stomach because food can reduce absorption. For extended release formulation, it can be taken with food as this may improve absorption. We usually advise the patient to take it once daily. This is convenient due to its long half-life. Finally, patients should avoid taking antacid at the same time because they may reduce absorption. Next, I will explain the care of administration for erythromycin. Many erythromycin tablets are acidic coated, so they must be swallowed whole and never crushed. Most forms should be taken on an empty stomach to ensure the best absorption. However, the enstone form can be taken with food, which may actually increase absorption. Taking food with erythromycin may help reduce nausea and stomach cramp, which are common side effects. Erythromycin has more gastrointestinal side effects, so patients should be warned about possible discomfort. Finally, avoid combining erythromycin with drugs that interact with liver enzymes because this increases the risk of adverse interaction. Next, I will be present the general head teaching for azithromycin and erythromycin. First, how to take. Patient must take the medicine exactly as prescribed by their doctor. Both azithromycin and erythromycin can be taken with or without food. For oral substitution, patients should shake the bottle well and always use a proper measuring device. Most importantly, they must complete the full course of treatment even if they start feeling better. Second, misdose. If a patient forget a dose, they should take it as soon as they remember. However, if it is almost time for the next scheduled dose, they should skip the missing dose and continue with the regular schedule. Patient must never double the dose to make up for the missed one, as this can increase the risk of side effects. Third, storage. Medicines should be kept out of reach of children and stored at room temperature, away from heat and moisture. Patients should always follow the label instruction carefully. As one is precaution, patients must inform their doctor about all medicine, supplement, or herbal product they are taking. They should always disclose any history of heart problem, liver disease, or arrhythmia or erythromycin. Special caution is needed if the patient has electrolyte imbalance such as low potassium or magnesium. Certain drug interactions are dangerous, so patients should never start or stop medicine without consulting their doctor.
Under health teaching for diet, we go to erythromycin. It is best taken on empty stomach 1 hour before meal or 2 hours after meal, unless gastric upset occurs. Avoid grapefruit juice because it may increase the drug levels. We need to drink plenty of water to reduce stomach irritation, and also avoid alcohol so that there is no increase in liver stress and nausea. If stomach upset is bad, take it with a light snack such as biscuit or bread, but this may reduce slightly of absorption. For azithromycin, can be taken with or without food, but if gastric upset occurs, take it with meals. We should avoid antacids containing aluminium or magnesium 2 hours before or after taking the medication because these antacids can reduce absorption. Next, for health teaching of side effect for azithromycin and erythromycin, we go to azithromycin first. Azithromycin, if it is not taken properly, it will cause antibiotic resistance, so future infection is harder to treat. Infection relapse or worsening if not completed properly. It will also cause liver injury that will appear as nausea, jaundice, or dark urine. It will also cause heart rhythm problems, which is QT prolongation like dizziness or fainting. It will also cause allergic reactions such as hives, swelling, or breathing issue. For drug interactions, it is less than erythromycin but still possible, especially with antacid. Side effect for erythromycin. First is hearing problem, especially for erythromycin. High or repeated doses may cause temporary hearing loss or tinnitus. Next is drug interaction. Taking erythromycin without guidance increase the chance of dangerous interaction with other medicines such as antihistamine or warfarines. Third is heart rhythm problem, which is QT prolongation. High doses or unsafe combination with other drugs can affect the heart electrical activity like palpitation, dizziness, or fainting. Fourth, liver damage, which is hepatotoxicity. Erythromycin is processed in our liver. Misuse can overstress it, causing jaundice.